Hello, my name's Diane, and I'm the lead advisor for Voluntary Action Camden's Community Partnership Service. Welcome to our series of podcasts under the series of Protecting Children in the Community, safeguarding essentials for all community BME groups, faith groups, supplementary schools, and any organisation that's working or delivering services to young people in the London Borough of Camden. Today, I'm hoping to talk to Leethen Bartholomew, who is the head of the National FGM Centre. It's doing a lot of great work, and hopefully we'll be able to find out what exactly it is that they're doing and how they're adjusting and adapting services during this COVID-19 pandemic. So let's try and connect now. Hi, hello. Thank you, Leethen, for joining us. We really appreciate your time. I know that it must be a bit busy because I know you work in lots of different boroughs in London, don't you? So actually, you don't work in Camden, or do you get referrals from Camden?
Well, we haven't received any cases from Camden, but we deliver training on behalf of the Safeguarding Partnership in Camden.
Okay, yeah. And I think I just wanted to just point out that in terms of it, the organisation being called the National FGM Centre, it's very important to note that you don't just do FGM, you actually deal with lots of other, for BME communities, lots of different other.
Well, the National FGM Centre is a partnership between Barnardo's and the local government association. And we work on the issue of FGM and other harmful practices. So we started off in 2015 working specifically on FGM, providing a response in local authorities and communities, delivering training, and having a website where we have a knowledge hub that acts as a repository for research, data, resources, and tools on FGM. And then in 2017, our remit was extended because we are funded by the Department for Education. And they ask us to not only focus on FGM, but to focus on breast flattening and abuse linked to faith and belief.
Right, okay. Which is what, I mean, if anyone has had a look on the website, you'll see there's lots of great resources on there in terms of advice and support for anybody who's dealing with those issues. Yeah. So, I mean, so in terms of the first question I was going to ask you was, how was the National FGM Centre had to adapt its response in response to the COVID pandemic? Everybody's sort of thinking about different ways of working, but still supporting the vulnerable. I just wanted to ask you about that, really.
Yeah, so our model is we partner with local authorities. And in London, we are currently based in 3 local authorities. So, we place our social workers within children's social care, and they are responsible for providing us a system change in how the local authority respond to cases of FGM and other harmful practices. So our workers, they will be either allocated a case or work jointly with the social worker that's allocated to the case, and provide an intervention, the direct work with children and families. We will do awareness raising sessions with professionals, deliver CPD accredited training as well for across the multi-agency landscape in the local authorities where we are based. Now, the number of referrals that we've received in the local authorities has actually dropped, which is very worrying for us because, you know, mothers are still giving birth. Health is our referrer. Along with followed by schools, and schools not operating as normal as we know. The children who would have been referred because there were concerns, or mothers who or fathers as well, where children would have been at risk, we're just not getting those referrals. So as I said, it's a really worrying time, and that's why it's really important for those of us who are seeing children, whether it is a member of the community or a family member, or you're a family friend, or you work in a food bank, or you provide some form of community support. It's, you know, you are our eyes and ears now. We're going to rely on you to, you know, make those referrals or just have those discussions with children and families.
And in terms of referrals, I mean, as you said, we haven't got schools, we don't have teachers and social workers and all these other people who are sort of trained to sort of safeguard children. Now we've got to rely on members of the public, if they hear everything, as you say, volunteers, those working in food banks, etc.
Yeah.
How can they go about referring to your organisation? Do they need to do that through a local authority, social services institution, or can they? Yeah.
Yeah. So if it's a case of emergency, dial 999.
Of course.
Yeah. If you need to make a referral, just follow your normal safeguarding procedures. If
Right.
your organization has been set up, or a project has been set up in response to COVID-19, safeguarding should be at the heart of it. So you should ensure that all staff and volunteers, they're aware that if they have a concern, who within the team they should report it to, who will then pass it on to children's social care and the police as well. It's important to remember that these organizations are still operating as normal. So don't think that you're going to add any extra pressure on them. They are going to respond. If you as well just want to have a discussion with someone, I would advise people as well to call the NSPCC helpline, which is 24 hours, or you can go online and report it on the NSPCC website as well.
Fantastic. Thank you. Thanks for that, Leethen. And so obviously we talked a little bit about referrals. So referrals has dropped. Obviously you've got existing referrals that you were working with before COVID. Those are still ongoing. How are you reaching out? Because I've been speaking to a lot of people who are saying that they're a lot of social workers and also a lot of teachers that are saying they're finding it really difficult to getting hold of their cases, of their families. Obviously we can't go around there, so we're just calling round regularly to see if they're responding. Is that how you're going about things, just calling and trying to keep in touch with those existing families if they need support?
So that's what I've been doing, and also undertaking what we call virtual visits. So
right, so that's happening.
Yeah, so
that's going well.
Well, I know of at least one case where it happened, where the social worker had to make contact with the family. Well, it's obviously an open case, so they know the family pretty well, and they did it over, virtual, and so spoke to the child and to the parents using that medium.
Okay, so that worked. I think any way we could reach these children, I think is really important. I was speaking to somebody from the Prevent team, and they were saying that they're really worried that all of these children who were vulnerable, obviously they're not accessing school, so they're it's only key workers' children that are in school, and all of these children, we have to try and find them and try and locate them. So that's really good. I know IT access and all this other stuff comes up as well, but where we can, we have to do what we can, I suppose. Yeah. So thanks for that. So I just wanted to talk about, in terms of question 2, and we've seen obviously a rise in the number of DV and neglect cases, obviously in line with the national picture. And as well as we've actually had a Section 16 place in Camden, because there's just been a rise in gang violence and that sort of thing. And I know that you said that your referrals have dropped, but are you hoping that, I was looking on your website and trying to get some information there, but how can we encourage, how can we use this platform to encourage people that, you guys are still out there? I know you said that your referrals have dropped, but you're still out there, you're still accessing, you're still supporting families, because this podcast doesn't just go out to Camden, it goes out to all boroughs. And I know you get referrals from all boroughs, but just to reassure people that anybody can contact you if they've got a concern, right? They don't have to worry about.
Yes, they can. And we've been exploring this whole idea around the increase in domestic abuse cases, which is something that's been communicated on the media, and which is it's a really difficult time for survivors. And So that whole message around self-isolation, it would protect yourself and protect the NHS, but self-isolation for some increases the harm towards them. So you have nowhere to go. So it's really good to see that, Hestia and Boots have partnered to provide safe spaces for victims. But part of the message that we have been sending, which isn't, we're not hearing as part of the narrative, is that there is a correlation between domestic abuse and FGM. There is some research that shows that a woman who's been cut has an increased risk, in some cases, 3 times more likely to experience interpersonal violence. So what I would say is that it's really important for communities and organizations that are providing support, or if they have an opportunity to transmit any messages online as well, that not to ignore the FGM, to explore that part of a woman's experience, to see if there is a link, and include it in the support that you're going to provide for her, if it's just online or telephone counseling at the moment, or if it's a space like a refuge, that part of her experience and not ignored. But for us as well is that we've produced a number of infographics that's COVID related. So there's one on COVID and gender-based violence. And
is that on the website now?
Yep. So it's sorry about that. Let me put my phone on silent. So it's on. I'll send you a copy of it, so you could.
Okay. Yeah. And what I can do is I can upload it onto the VAC website for everyone. So that'll be really useful. Yeah. Brilliant. Thank you, Leethen. So, I mean, I was sort of hearing on the news, and obviously it's coming through a few of some of the church, some of the faith-based organisations that I work with. The recent news stories that certain churches and faith groups are promoting and selling these sort of COVID-19 protection and miracle cures. Obviously, these are going out specifically to sort of BME communities. One of them that I saw was an oil that is going for about sort of 70 quid a pop. And if you can imagine, these sort of faith-based organisations aren't getting congregations together, so there's no collections going on, so they're finding different ways of raising money. I mean, this query that I had come through, it actually was somebody operating almost like a call centre selling these cures. So I just sort of wanted to have your thoughts on what really can be done about this, and apart from saying to sort of parishioners and sending the message out in the community that the World Health Organization haven't or anyone or the public health haven't sanctioned any of this stuff. So it's really important that we follow guidelines and don't part with your money, sort of thing.
I think that your faith for many people is really important, and you turn to your faith more than any other time when you're going through misfortunes and challenges in your life. And for some, it's a source of strength, and that's exactly what they need to take them through whatever they're experiencing. So I would say, that use, if your faith is your source of strength, use it, but you have to ensure that what you're doing doesn't place you, at further risk. And I know that some people would say that you need to show faith, and by having faith, this is how you're going to overcome it, whatever it is that you're experiencing. But everything has its place, and turning to these type of cures now, where the one that I saw on the news and that I read on the newspapers was that it was charging £91, and
oh my gosh, wow,
gold. And we're talking about some communities where people would have no recourse to public funds, people on limited income, they're probably made unemployed or redundant, and this for some would be, they would buy into this fear of I need to work now, so I need this form of protection. And then it becomes a serious public health concern where you're relying on this thing that is given to you as a cure. that has some form of supernatural cure, protection, as opposed to going to your doctor or going to your GP or seeking some form of medical help. So it is a serious public health concern. So I would ask people, to, use your wisdom. If you have to pray, pray. But but go to your doctor if you're not feeling well. The main message is seek medical attention. That's what the NHS is there for, to protect us when we're not feeling well.
And actually, they've said, haven't they, that they've seen a drop in sort of people coming to A&E and for general things, or and we don't have figures about how people are coping at home or what's happening. So I would reiterate that message and say, definitely, it's really important.
And it's important to remember as well that for many BME families or communities, that they live in two worlds. They live here in the UK, but they also live back home. So they hear about what is happening here in the UK, where is it disproportionately affecting BME communities, and that would make people feel very fearful. And then you hear in the news back home of what is happening and how many people are dying, how many people are sick. So it's like a double fear and anxiety that they would have. And if someone comes along who you respect and who you think that has that supernatural ability, that's selling you something that would protect you from death, and you have all these people that are relying on you, and especially BME communities, sending money back home for family is that's something you do either weekly or monthly.
Absolutely,
and so I can understand why people would want to buy these things. But it's as I said, it's a public health concern, and I would advise people not to do it.
Definitely. And I just want to pick up also what you were saying about it's on the news now, and obviously there's going to be an investigation of the data emerging from people from sort of Black, Asian and minority communities sort of being disproportionately affected by COVID-19. And I just wanted to know what advice you would give to professionals or, safeguarding leads, because those are usually the people who would attend my training, the people who are the head of organisations, charities, groups, who ordinarily would be supporting communities, during outside of COVID, but also during. I had a query in the week of a lady who's just regularly calling round to all her regulars, and one day she'd call and she said, "Yeah, I'm feeling a bit low," and then a couple of days later she'd call and she'd say, "I'm suicidal." And a couple of days later, obviously she's signposting, and then a couple of days later she'd call and there would be no answer. So then your mind starts thinking the worst. But just in terms of those advice would you give to those safeguarding leads and those professionals who are working with vulnerable families during COVID, who can't physically access and support in the way that they would?
I think when working with BME communities, there's something around community trauma. I know that as an individual, you could experience some form of event that really shocks the core of who you are and becomes very traumatic. But that could also translate to communities as well. So we're talking about communities, social groups, or neighborhoods who have experienced some form of structural violence. Or some form of historical harm, and it could be transmitted from one generation to the next. And at the root of it really is around social inequality, poverty, racism, and the oppression that they experience, right? And this causes this group to experience some form of trauma. Now, when you experience this trauma, and then you have COVID-19, this pandemic, and it says that because you have experienced inequality, poverty, and these things, it increases your risk to contracting coronavirus. That in itself, as well, as an additional trauma built upon the existing trauma that they're already experiencing, and the bereavement that they all have to go through. So in any group that's providing support for communities, it's really important to look at what's happening within the context of what was already happening within society to these groups. And so in our response, we may respond in an individual way to our clients, but we also need to respond in a way that would bring about some form of system change for social groups and for neighborhoods. So it's really about community building, and it's about engagement, really. And, at the heart of that is about being open and honest about what can be provided. It's from starting off, like, we're going to have this conversation, even if it's on an individual level, but, there's probably a limited amount of things that I can do right now, given the situation. And this is what I can provide. Even if it's that listening ear, even if it's, I'll need to go away and make a few calls to find out what is available or who can help. There would be a delay in my response given the situation, but it's just,
and that's fine.
And that's fine, but it's just giving people that hope and reassurance, and helping people to be anchored in hope that, that we will, because, I've been seeing a few on social media pictures, someone is putting up pictures that we will get through this. And it's important to let people know that we will get through this. Is that there's that old hymn that says, "One day at a time, sweet Jesus." People know it, and probably we need. That's it. We need to take it one day at a time and help people to understand. If a day is too long, we will do 1 hour at a time. If an hour is too long, it's a minute at a time. But I'll be there for you. And that's the thing. Because one thing this pandemic has helped us or allow us to develop is our connectedness. And do this without each other. But and just reassure that they're not going through this alone. There are other people going through this as well. And support will be provided. And probably that's what needed as well, is that people who are going through the same thing.
Absolutely. You and I, everyone.
They connect to each other. So that if I have to homeschool my child and I'm finding it really difficult, it's good to know that other parents finding it difficult, and then you start to talk and then you share ideas. So how virtually or even on a call, connect people together to talk about the experiences that they're going through. It doesn't have to be an hour-long call. It could just be a chat.
Yeah, absolutely. And not feel like, you're limited in yes, we can't do all the things that we could do before, but actually we're not limited. We can still do something. I think that's really a really positive message. And thank you, actually, because sometimes I think I had it said to me once, gosh, this is really heavy. This stuff is really heavy. Safeguarding is heavy, and talking about abuse and all this other stuff, it's really heavy stuff, and it's really important to remain hopeful, I think.
But I think that safeguarding doesn't necessarily have to be a heavy stuff, right? Because when we talk about safeguarding, we normally talk about it in a pathological way, about what's not good and what's the harm that can cause. But know that there are good stories as well. So how do we bring them to the fore, those good stories, to give people that encouragement, because you don't want to bombard people with things that are already too negative.
Absolutely.
And so what are those things that are making a family resilient now? What are those factors that we know that then we will have to try to replicate that with other families?
Yeah, that's really practical, actually. Yeah. Well, I mean, thank you so much, Leethen, for your time. And so what's your day going to look like today now that we've...
Well, I still, it's, my work actually hasn't
slowed down.
No. So I have 35 emails now to go to read.
Wow. Okay.
Evaluation report to read today as well. And then I have the team to support as well. So we make our daily calls to each other and try to support each other out.
Well, and I just want to say all the best. And, obviously you've always been really supportive of the project in the past, and even currently with me, I know, because you used to work closely with Ashakin. So thank you so much for your time today, and hopefully we'll be able to connect again. I don't think that this remote working is over. I think maybe it might be here to stay for a bit.
Mm.
So hopefully we can connect again, or actually probably in person would probably be good as well.
Okay.
So thank you so much for your time, and all the best, and to your team as well.
Have a good day.
Thank you.
Okay, bye.
FGM Centre, and as he said, once he sends me those resources, I am going to put those on the VAC website under the Safeguarding Project page, so you'll be able to have access to those. And also, I've got a few other resources that you might be able to find you might find useful. Also, there's some training coming up. Camden's Children's Safeguarding Board offering some free training. I'll also put the link on there so that you can access that all remotely, and it's all really useful for working with families at the moment with COVID. So hopefully I'll be able to join you next time, and we'll be able to discuss some other safeguarding concerns. My email's on the website, so if you've got any queries or you'd like to discuss anything with me, hopefully we'll be back delivering safeguarding training soon. I do run an advanced course, safeguarding advanced course, and I do like to run that in person. Obviously, we'll make sure that we're ensuring our social distancing rules and find out how we can possibly